Good morning, management. In fact, we already started the topic that is the normal physiological changes occurs during the postpartum period. Okay, so systematic changes, we already learn about the cardiovascular system and respiratory tract function. Okay, now we will learn about the another system. Okay, so in that first, that is the excretory system. We all know that in excretory system the waste product and how kidney works in our body. Okay, so what kind of the changes occur in mothers in postpartum period? So first of all, in excretory function, body water in the extravascular spaces and excess plasma volume from the pregnancy are rapidly eliminated. Okay, so all waste product and extravascular species during the pregnancy phase all are eliminated into the puerperium period. But in second postpartum day, the diuresis and polyuria occurs. Okay, so polyuria means excessive urination flow occurs into second day of the postpartum, and also diuresis occurs, but up to 3 liter per day urine is passed for few days, because in pregnancy phase the pressure on the bladder is increased, but after the birth of the baby in postpartum period the pressure is decreased automatically, and the urine up to the 3 liter per day is passed, okay, in few days. Then bladder increased capacity and filling up to 1000 to 1500 ml of urine without the discomfort. So now the bladder capacity also increase into the puerperium. Okay, so woman can easily pass out the urine. Okay, urine per day without any discomfort. Then retention of urine may result because of the stretching of the perineal fluid, bruising and edema of the trigger and urethral meters. Okay, so retention of urine means the in problem or difficulty in the voiding. So it may result due to the stretching of the perineal muscles, then bruising, okay, rashes and some edema. But now in puerperium period these all are the disappear. Then regional or general anesthesia may temporarily inhibit natural function, diminishing urinary sensation from the bladder. Okay, so now anesthesia also works due to the natural function of the mother, and diminishing in urinary sensation means the loss of urination or the decreased amount of the urine from the bladder is occurs. Then urinary retention follows, putting the woman at a risk for hemorrhage from a poorly contracting the uterus. So urinary retention means difficulty in voiding. So in that case, woman having a risk of the hemorrhage, and also during the poor contracting uterus means capacity of the uterus is decreased day by day. Okay, so the stress is also predisposed to the urinary tract infection. So it may lead to the high chances of the infection spread into the uterine cavity and affecting mother, very risky. So this is the excretory function. Then in increased membrane permeability persist for first week, then proteinuria of up to 1 plus, then glucose passed in from galactose and urinary ketones may be present. So what kind of the waste material present in mother's urine? That is the excessive protein value in urine. Okay, then glucose, that is the high level of the galactose present, and urinary ketones also present into the urine. Then dilatation of the uterus and renal pelvis require about 6 weeks to return to pre-pregnant state, and in urinary stresses microorganisms can easily travel upward causing the kidney infection. So by the dilatation of the uterus and renal pelvis, it require up to the 6 weeks for up to the pre-pregnant state. So it takes the time of the 6 week of time for becoming and returning into the pre-pregnant state. So in urinary, during that period 6 weeks, microorganisms can easily travel and it can cause the infection to the mother. So this is the excretory function. Next, that is the gastrointestinal function. So next system, that is the gastrointestinal function. So increase the thrust in early puerperium is due to the loss of fluid during labor, lochia, diuresis and perspiration. Obviously, mother having exhaust and continuing pain. So many perspiration and fluid loss, blood loss occurs into the delivery phase. Okay. So due to that loss of the fluid and lochia and blood and other products, the increased capacity of the thrust is very increased into the mother. So mother want to take more water and fluid in body. Okay. So need of the body and body fluid is increased. Then slight intestinal paresis leads to the constipation. Okay. So the slight intestinal paresis, so it may reason for the constipation of the mother. So mother can't defecate the defecation. Okay, problem in a defecation. Then lack of tone of the perineal and abdominal muscles and reflex pain in perineal region are contributing. Okay, so during the delivery phase, the loss of abdominal muscle tone and perineal muscle tones are already decreased, and reflex pain in the perineal region are contributing factors for the constipation. So this factor is mainly lead to the constipation. So the ambulation, progression of diet and anti-fluctuants or enemas generally make up the woman more comfortable. So due to avoid the problem of the constipation, we can provide proper diet and hygienic maintain, and or we can provide the enemas to the mother. During delivery, the straining and pressure on the lower bowel causes the extrusion of internal hemorrhoids. If mother having the internal injury or internal hemorrhoids, in that case we can provide the lower bowel so that we can relieve the pressure. Okay. So after delivery, these reduce in size. Okay. We all know that the decreasing in size of the uterine cavity and abdominal muscle tone also decrease. So it can be manually reinserted into the rectum. So for providing the problem of the constipation, we can given this kind of the treatment. And hemorrhoids present during pregnancy also shrink and rarely require the surgical reduction. If hemorrhoids are increased day by day during pregnancy, then it can reduce by the surgical reduction, or automatically it shrink during the pregnancy phase. So the speed with which bowels becomes the regulated depend on the daily activity, diet, fluid, exercise and mild laxative may be ordered by the doctor to facilitate the emptying of the bowel. So doctor prescribes this kind of the fluid, proper diet and exercise means laxative means relaxation, no constipation is in faced by the mother. So in that case we can provide the mild laxative of also by the doctor's order. So this is all about the gastrointestinal function and changes occur into this system. Okay. Next, that is the integumentary system. That is the skin. So which kind of the skin changes occurs into the puerperium stage. So after delivery, the skin changes caused by the pregnancy and become the dressing. As the melanocyte stimulating hormone, that is MSH, that cause the pigmentational changes in eliminated melasma disappear, and unless excessive pigmentation has occurred. We all know that such kind of the changes during pregnancy like pigmentation, calosma means red or whitish spot on cheeks and face. Okay, so all that are disappear after the pregnancy, and the major role of the hormone, that is the melanocyte stimulating hormone, this due to this hormone this kind of the changes occur into the skin. Then stria gravidarum may fade to the silvery color in light skinned woman, but they remain deeper or darker in a skin. So due to depend upon the skin tone of the mother, the stria gravidarum day by day decrease in the marks. Okay, so on the mother marks abdomen, that kind of the marks are removed and the linea nigra also darken and areola fade. But in some women, faint traces will persist. So in some women, we can find out the long time also. In few months, hair and nail growth will return to pre-pregnant pattern. So not only the internal organs but also skin, hair and nail growth will return up to into the pre-pregnant state after the completion of the puerperium phase. So this is about the skin changes. Next, that is the musculoskeletal function. So which kind of the changes occurs into the bone and development. So woman may be fatigued or exhausted during the labor pain, and the labor position and pushing technique may leave the arms, neck, shoulder and perineal muscles or an aching. We all know that we heard that one delivery can pain all our breakdown of the bones of body. So in that case, the bones and arms, neck, shoulder all are not strong. They are destroyed during the labor position and technique. So women face this kind of the problem during the labor. So which kind of the muscles position and joints position? So that is abdominal muscles. Uterine ligaments remain loose and relaxed. Now ligaments all are loose after the labor pain. Okay. Then abdominal muscles have less tone and resulting in soft flabby abdomen. Obviously, now fetus is come outside as a baby form. Okay. So in that case, the abdominal muscles are loose and soft and flabby abdomen. We cannot feel hard or firm, but flabby abdomen we can feel. Then exercise may help, but restoration of the muscle may be prolonged. By doing the exercise regularly, mother can restore the muscle tone. Okay. This is about muscles, and what about the joints? That is under the influence of the relaxation, the pelvic joints, particularly the symphysis pubis, may separate slightly during the labor and causing pain and discomfort become stabilized up to the 6 to 8 weeks. We all know that is the puerperium stage is prolonged up to 6 weeks, 6 to 8 weeks. So joints are comes return into the pre-pregnant state after the 6 to 8 week by resolution of this kind of the problem. Okay. Next, that is the endocrine function. So in endocrine function, what kind of the maternal health affected? That is menstruation and ovulation. In these two phase, mother have a changes in these cycles. Okay. So the exact mechanism responsible for the resumption of the menstrual cycle is unknown. Okay. We cannot find out the reason of the resumption of the menstrual cycle, but time of the resumption is unique for each individual. So for all mother, the time of resumption is the different. Okay. Variation in this that time. So cycles can begin in lactating mother as early as 8 weeks after delivery or as late as 18 months. So the menstrual cycle begins in lactating mother as early as the 8 week or in late 18 months. Okay. But 40% of the lactating mothers may have their first menstrual period as early as 4 to 6 weeks after the delivery. Mother faces 4 to 6 weeks the menstrual period, okay, after the delivery and labor pain. But 90% of by a 24 weeks. In some cases, mother having a heavy bleeding. So in that case, 24 weeks. It is because prolactin level interference with the development of the Graafian follicle. So for development of the Graafian follicle, the prolactin is level is a interfere, okay, for development of the Graafian follicle. So since the prolactin level is influenced by the strength of the infant sucking and the frequency of feeding, therefore breastfeeding is unreliable for a method of the contraception, okay, because the mother have to feed her baby. Okay. So due to the breastfeeding, it is frequency, then strength of the infant sucking. These kind of the factors affect to the prolactin level. So this is about menstruation and ovulation. Then immunological function. How mother's immunity work into the puerperium period. So we all know that the risk of the infection mother having very high. Okay, because all In puerperium period, all waste product and blood loss continuously occurs, okay, up to the 6 weeks. So in that case, the uterine cavity infection is highest. So puerperium women are at a special risk for the wound infection and infection of the uterus, uterine, urinary tract, respiratory tract or breast. We already discussed that is a mother having a high risk related to this kind of the tract, and so nurses can recognize them and teach them for how to prevent and report the symptom of the postpartum infection. So in that case, we can assist and provide the guidance to a mother for how to prevent the infection and how to deal with it, okay, how to prevent it. So predisposing factors such as diabetes, chronic respiratory problem, then anemia, malnutrition, substance abuse, etc. So in that cases, alert nurses in case of the prolonged labor, difficulty in delivery, multiple pregnancy, lacerative, hematoma, and cesarean delivery. So, due to this kind of problem, also mother having faced to the infection. Okay. Then next, that is the once the woman have a risk identification for the plan of nursing can be formulated to decrease the additional risk. So, mother have a high risk, we all know, but we have to inform priorly and identification plan for the prevention of the infection. Then the woman must be taught to recognize the warning signs and seek medical care. So if we can guide the mother and family members priorly, then they mentally prepare and they precaution for the prevention of the infection. Okay. Next one, that is the puerperial sepsis. Okay, so it is the most common postpartum infection of the genital tract into the postpartum period, appearing for before the 10th day after the delivery. So after the 10th day of delivery, mother having a high risk of the sepsis, puerperial sepsis, that is the genital tract infection. So all mother having a high risk for this kind of the infection. Then elevated temperature in first 24 hours after delivery may be caused by the dehydration, fatigue, chilling and blood loss. Obviously, mother having a blood loss, okay, and this kind of the all body changes. So the alteration in temperature is elevated and the temperature may be as high as 38 degrees Celsius is considered with the normal limit. So in that case, the 38 degrees Celsius is a normal limit. But if temperature remain high after 24 hours also, then cause must be found and treated, especially if there is a history of premature rupture of membrane or long or traumatic labor and delivery. So if fever is a continue after the 1 day also, then we have to report to the doctor so that we can find out the complication or priorly treat it. Then, if low-grade fever related to engorgement of breast is there, do not isolate the baby from mother because the infant and mother usually have the same bacterial and viral agents, so nothing is gained by the isolating. So in that case, we have to provide the breastfeeding by the mother to that newborn baby. So this is about immunological function. Okay, if you find any doubt in the systemic changes occurs into the puerperium phase, then you can ask. Okay, thank you.